Well, good afternoon. My name is Josh Greenberg, and I'm the director of the School of Journalism and Communication at Carleton University. I'm a professor in communication and media studies and a researcher whose work focuses on media coverage of pandemics, risk perception, and health risk communication during outbreaks of infectious disease. I'm thrilled to be joining you today and to introduce our next keynote speaker. Before doing so, allow me very briefly to congratulate my colleague, Alan Thompson, along with the team of student journalists who are producing some outstanding coverage and social media content, the conference organizing committee, the institutional partners for this conference, and all of our journalism faculty, staff, and students. Congratulations on 75 years of excellence and leadership in journalism, research, education, and training, and for putting together such an outstanding event. I've worked with Alan for 15 years, and I can tell you he's been going full tilt for months to bring this event to fruition. And while it's online and not in person, as we would have preferred, I think it's given us an opportunity to bring together some amazing speakers from the worlds of journalism, public policy, and public health, who might not otherwise have been able to attend had this meeting been on campus and in person. One of those people is our next keynote speaker, Dr. Theresa Tam. And as a media and risk communication scholar specializing in public health, I've followed Dr. Tam's work for the past few years and particularly closely for the last 8 months. I hope you'll join me in recognizing her tireless public service and the commitment she's shown to protecting the health and well-being of Canadians during this period of heightened risk and uncertainty. Dr. Tam has been Canada's Chief Public Health Officer since 2017. She's a physician with expertise in immunization, infectious disease, emergency preparedness, and global health security. As the federal government's lead health professional, Dr. Tam provides advice to the Minister of Health, supports and provides advice to the President of the Public Health Agency of Canada, and is empowered to communicate with other levels of government, the voluntary and private sectors, and Canadians on important health issues. We're thrilled Dr. Tam accepted our invitation to be one of the event's marquee speakers. Those who have followed media coverage of the COVID crisis are used to hearing from Dr. Tam almost every day. Her daily media briefings are not only intended to keep journalists apprised of the evolution of this outbreak and its impact in Canada, but to also ensure that Canadians are hearing directly from their top public health official. Rarely, however, has Dr. Tam had the time or opportunity to speak openly about the challenges of communicating with the media and with Canadians broadly about this highly complex and challenging disease. Being skilled in media relations and risk communication in this context demands a deep understanding about the increasingly fragmented mediascape in which we all live and work, from which we gather our news and information, and where we share what we're learning and how we're feeling with others. Dr. Tam will speak for approximately 15 minutes, after which there will be opportunities for you to pose questions. We're asking that these questions be posted using the online Q&A function. And as moderator, I'll do my best to ask as many of your questions as possible, but please understand that given the limitations on time, it may not be possible to get to all of them. Our session ends at 1 p.m. Thank you again for your attention and your interest in the conference and in this session. And it's now my privilege to officially welcome our keynote speaker, Canada's Chief Public Health Officer, Dr. Theresa Tam.
Good afternoon, good day, everyone. And I'm really, really pleased to be here for this incredible event. I would like to acknowledge that I am on the traditional and unceded territory of the Algonquin and Anishinaabe people. And I'm really pleased to connect with you from your various territories and communities that you are in today. So congratulations for sure to the Carleton School of Journalism and Communication on this auspicious anniversary. Certainly, I think the pandemic has really shone a light on the imperative for reliable, sound, science-based advice to keep Canadians safe. So effective communication of public health advice is as important as a vaccine. I've always said that, whether it's this pandemic or others, we may not have a vaccine or specific treatment for a while. So the communication and getting the general public to do all the things that they need to do to try and protect themselves is of paramount importance. So learning from each other is so important, and taking the opportunity to do so. I learned a lot from great journalists and risk communications experts, one of whom is John Rainford, my colleague, who unfortunately passed away about a year ago, in 2019. And well, actually, I've lost count of my years now. But in any case, I know that he has a sort of special connection to Carleton as well. So just a quick reflection on how I find the whole thing a bit sort of surreal. You know, in public health, I always say the population is my patient rather than an individual. That means collective approaches dealing with many complex health challenges. We are often sort of behind the scenes, promoting health, preventing illnesses, so that people don't see us very much. We're somewhat invisible, although we do, you know, one of my jobs is communicating with the public. But now, you know, as Josh reflected, since the pandemic started, every minute of the day, you see one of us, myself, other chief medical officers on TV and other media providing information. And, you know, I think I've done certainly over 100 press briefings and as many teleconferences with chief medical officers and deputy ministers, and in order to do my job in providing advice and helping to really gel some cohesion amongst medical officers of health, recognizing that health actually resides in the responsibility of the provinces and territories and the local public health. But it's really important, I think, for the general public that we provide that sense of unity and cohesion. You know, when I think about my job, in many ways, my job and that of journalists share many of the same goals. And we share information to promote and protect the health of Canadians. We seek out the highest quality of evidence, and we have to remain open to evolving evidence. And we offer our skill and talent to the service of others and for the greater good. Public trust and confidence in public health officials and our advice is essential during the pandemic so that the public, as I say, can protect themselves. So media are an important partner to what we do. So on our part, we have to facilitate a good understanding of how things work. How does this virus transmit? How does it behave? Are there any changes? What's going on in the country in terms of the epidemic? Journalists fairly offering opposing points of view, reporting on results, and you play the role of the watchdog, obviously holding to account policymakers and politicians and many others. So I've really very impressed, I think, to date with how everybody's come together with the public as a country to help stem the transmission of COVID-19. So, you know, I think if we all stood back and maybe, you know, move the clock to, you know, a few years from now, we will look back to how extraordinary of an event we are experiencing now. We're all bearing witness to. Not just a health matter, but the significant impact on society, on the economy. When, you know, 87% of the global student population was affected by school closures at the end of March, when I sort of see the Prime Minister and the President of the United States announce that there were going to be border restrictions on the world's longest international border, that was an astounding announcement, I think, in the history of these countries and globally. And many of our businesses retooled to generate personal protective equipment and other equipment that the country needed. So society as a whole mobilized to respond in many different ways that we haven't seen before in recent memory. As the pandemic evolved after planking that first curve, we're now seeing how communications sometimes can appear to be inconsistent because the pandemic is different in different parts of the country. We have different experiences and contexts. Public health authorities have put in measures that have to be titrated against the epidemiology, but the context they work in. I think that's the moment that we're living in now, and it's a challenging moment. What we are trying to do right now is continue to keep the public together, listening to science-based advice. But the core public health messages we wanted to convey is that they don't actually change, haven't changed that much. It's about the core messages of physical distancing. So we're all on the same page on that. The frequent hand washing, wearing a mask, staying at home when you're sick, avoiding, overcrowded rooms with poor ventilation. But, we are living in a more challenging period, I think, right now, to convince people who are fatigued to stick to sustainable habits or public health practices. So I'll just touch on a few sort of communications challenges I think that I see from where I'm sitting. And so, of course, this pandemic, as it began, had to evolve, and our knowledge on the pandemic, on the virus, evolved in real time. And because of our work and the work that journalists have done, and many others and scientists, everyone has access to information in the internet age. Everyone is an armchair epidemiologist. They all think they know how to interpret information. And, but the very nature of a pandemic is extremely complex, and there's a degree of uncertainty that changes over time. So as the CPHO, I'm in a very complicated situation. Advice and decisions are complex ones. They're not black and white, yes or no, someone makes a decision. And so it is very challenging to externalize some of those complexities, which we can't do because we have to provide information to the public that's in sort of usable, in a usable manner. So of course, we have been criticized as public health professionals for changing our advice over time. But we have been doing so because the science is evolving. And the classic example is the wearing of the non-medical mask. And sort of as we evolve the understanding, particularly at a point when we understood that asymptomatic people can transmit, then everybody wearing a non-medical mask can protect each other and reduce transmission, even in the light of, quite frankly, just case studies or reports. There's not a huge amount of evidence, but you kind of have to move even in that context to provide advice. So as science evolves quickly, this kind of change, I think, is to be expected. It will be very helpful for journalists to pre-position that at the same time as we are trying to do this. Science is playing out in real time in front of TVs and the internet. So scientists who normally debate things behind closed doors in journals and having peer review isn't doing so anymore. Clinical trials, every time there is an adverse event, it gets reported, when normally you actually have a very thoughtful process of evaluating all of these things and then communicating it. So that is extremely challenging. There is the word public is in public health. You got to put public into public health and realize the public will have their own intuitive views on what makes sense, and this shapes compliance, and they will make their own decisions on how to behave under certain circumstances. And so therefore we have to make the information usable. And so I think the next challenge I find is, having new ways of communicating, more effective ways of communicating is challenging, I think, for the public health professional, and we can learn a lot more perhaps from journalists. My predecessors have never had to deal with a pandemic in this internet and information age. I wasn't a person who was on social media a lot in my private life, quite frankly, or in my professional life, not so much. But I saw my Twitter account being used. We're trying to use it more effectively, but that only reaches a certain audience to build trust. But the people who joined the Twitter account has escalated tremendously at the beginning of the pandemic. And I've had to learn and my team had to learn well, how do we use that tool more effectively? And so I think we can perhaps have a discussion on, of course, misinformation and disinformation that travels, as I said, faster than the virus can travel in this internet age. And people can only tolerate sort of small sound bites and videos and sort of new ways of graphically maybe representing complex information that I think we need to do better, but maybe there are others out there who can help us do that as well. But in the bottom line is we need those tools to provide that sort of consistent messaging that is going to be useful to people. And so I think, you know, in this second resurgence of the pandemic, we're seeing a different demographic of people being impacted, the younger adults, the younger Canadians. And we really needed to adapt our message and be more targeted. We have a very diverse population in Canada. We needed different ways to reach different populations as well, in more visually appearing ways, as I said. I mean, we are trying many different ways of engaging young people right now, including using sort of gaming concepts and companies, as well as the usual internet and social media platforms. We've seen the growth of expert debunkers. You have some presenting to you, I think, in this conference, and websites are now charged with, that's what they do. And I think the public also has to learn more about being more media savvy, as well as being scientifically more informed. The third challenge, I think this pandemic, we need to be pretty humble about our experience in Canada, because of course it's shone a spotlight on the cracks in our social systems and our health systems, where a number of different groups in our community are disadvantaged by inequities. And so I think as this virus and this pandemic unfolds, we all witness the significant gaps in the way of how we treat our seniors, and how we are treating those in a lower socioeconomic power, if you like, and personal support workers and other essential service workers who are on the front lines of the response and not being supported. And we've had to sort of escalate that kind of support. And so it is a magnifying glass on the cracks in our system. So it is incumbent, I think, upon public health. We are the proponents of health equity, the champions, the voice of in equity, and trying to do that on a chronic basis. But this pandemic's created, I think, an opportunity for all of us to lend a voice, give a voice to those who can't speak as loudly, and seek diversified sources of information. And so who your sources are matter. Gender equity. Having inputs from diverse populations is really important, I think, to the information that we all put out. So in closing, I think, you know, this is a very, very complicated dynamic and situation that we're working in, that's evolving. I think the challenge it's been laid out before us, this pandemic is a marathon. It's going to continue for a number of months. We've seen this uptick in cases now in the fall. And until we have a safe and effective vaccine, communications is extremely important and to sustain behavioral change, and will remain an absolutely critical public health intervention, even when we do have a vaccine. And carrying people through this period of fatigue, and continuing to protect those at high risk and those who are most disadvantaged by our socioeconomic gaps. We mustn't forget that we live in a globalized world, and that, you know, none of us are safe until everyone's safe globally as well. And we've seen incredible collaboration between sectors, housing, you know, support for people's wages. We've seen sort of all these people coming together, industry. So we need to sort of move forwards as we think about the future of pandemic preparedness, to be much more multi-sectoral and engaging. Pandemic plans, I think, must build health equity fundamentally in its core. No one has a crystal ball, and I keep saying that when I'm doing my modeling sessions, translating that information and forecasting things. No one has a crystal ball, but what I do know is that the path which this pandemic will follow in Canada and globally depends on our individual and collective action. That much I am certain. The stakes are high. You and I, journalists, have an extremely valuable role in sharing that information that saves lives, literally saves lives. So it's very important that we continue to depend on fact-based, foundational, science-informed, and reliable news media to support these efforts. Thank you.
Well, thank you very much for those insightful remarks, Dr. Tam. We move now to the Q&A portion of this session, and I'll remind everybody who's following along. It's great to see we have about 140 people following this session to please use the Q&A function to submit your questions. Questions are already starting to come in, so we'll get to those in just a moment. I want to begin by starting rather on the topic of misinformation, which you spoke briefly to. Some of our own research that we did at Carleton in partnership with Abacus Data this summer found that about 46% of Canadians believed at least one common myth or conspiracy about COVID-19. Among them, the false link between COVID infections and exposure to 5G wireless technology, hyped benefits of hydroxychloroquine for treating infection, false claims that SARS-CoV-2 was manufactured as a bioweapon. Why do you think so many Canadians are vulnerable to the spread of misinformation? And what threat does this pose not just to public discourse, but public health in Canada?
Well, that's a very big topic, and I'm really grateful for academia and Carleton, for example, that has provided some of this public opinion research, which is really important to do. It's a bit like doing clinical trials in the middle of a pandemic. You must do it. Otherwise, you wouldn't know whether hydroxychloroquine did or did not work, or a certain vaccine. So I think there's probably many different reasons why we're susceptible to misinformation and disinformation. So I think when situations are evolving and there's a level of uncertainty, it's fertile ground, I think, for people to provide that sort of all sorts of conspiracy theories and other injects of information that can have very serious consequences. I think unlike, pandemics of the past, it's not a lack of information, but it's too much information. So people don't really know what's credible or not. And so I think it's like information junk food is how I sort of look at it. Amongst maybe all the junk food, there's some nutrition in there somewhere. But the bottom line is people are curious. They're using technology to make sense of the world around them. They're eager actually for more in-depth understanding. So we need to actually provide it to them. Social media, everybody knows, is a double-edged sword. It's great. I used to do research and have to go and look through Index Medicus and then, try and find a paper and photocopy it. Now you have it all at your fingertips, but I think people still need to, if they really want to truly understand the topic, they either have to spend a lot of time doing research, or they're going to have to rely on maybe people like Ed Young, who does very in-depth analysis in order to translate complex scientific information and the contextual pieces in order to provide that information to people. During the pandemic, I believe a lot of people at home sitting in front of the television. So of course, they're consuming a lot of information. So whatever is put in front of them, and television channels come from all over the place, whether it's US, Canada, I think we share the same channels. So people are getting different news. But I think there's some research, and maybe it was your group that did it, that shows that people get the news mostly from social media, more susceptible to mis or disinformation. Conspiracy theorists are saying, do your own research, when quite clearly people can't do that very well, and they have to be directed to, I think, more credible sources. I think, partly is public health does, I think, need to sharpen our social media skills if we're going to combat misinformation in that sphere. We have done some analytics, of course, of what that landscape looks like. And public health is sort of in this little echo chamber talking to each other, while some of the anti-vaccine groups or others are spreading information in a much more effective way. So we kind of need to sort of get into it, basically. Infodemics and tackling it, the WHO has a whole stream of workforce actually doing that. And public health doesn't have much capacity, and you kind of have to build that capacity in order to provide that information. We can do regular media briefings, and I believe TV is still a key venue for people to get information. But we are not as good at the compelling, visually strong, engaging public stories. I think journalists use that tool, that device, much more effectively in telling that human story, and we rely on you digging down to that, because we provide pretty sort of stark statistics, and behind every number there is a human story to it. And so I think the journalism superstars understand that and can translate the complex into human stories that people can relate to. And I've actually challenged the public themselves to use a bit of time to get media smart, to try and think critically and ask themselves like 3 questions, including where did this information come from before I pass it on. So I think everybody has a bit of a role, and as to why we're susceptible, I think, to so much, information junk food, as I said.
That's great. So I'm going to start digging into the questions that our people following along at home are submitting. First one is from our colleague Sarah Everts at Carleton. Vaccine hesitancy was already a public health issue when the pandemic hit. Now there's a president using a COVID vaccine as a lever for re-election, raising fear about cracks in the regulatory process. So obviously Canada and the US have different regulatory mechanisms, but the fear and unease doesn't really respect the border. So what are your thoughts on how to broach unease and misinformation about a potential COVID vaccine in Canada?
Yeah, so that's a bit of a bridge from the last question too. I think, as we all know, there's been an incredible global scientific endeavor to discover and research into new vaccines. Some of these vaccines are in trials right now. And, from where I'm sitting, the public, although they appreciate the rapid research, the word rapid and quick engenders a certain amount of concern. I think how I've tried to approach it is to communicate that regulatory process. Being fast track doesn't mean you skip the safety and effectiveness studies. Safety being the most important aspect, I think, to what the public wants to hear about. And as the clinical trial results are popping up all over the place, people are not respecting, peer-reviewed journals, these preprints, and in fact, even beyond the preprints is some sort of median announcement by company X or Y prior to the normal process of scientists and independent experts reviewing it is extremely challenging. But I think helping the Canadian public understand the regulatory process is one really critical element. And there actually are some very good Canadian scholars, behavioral scientists, and others that have been studying the vaccine confidence prior to COVID-19. And I think some of the sort of theories are particularly important to our current context. One is that, of course, as much as possible, I think I talked about this just this past week, is you wanted to actually immunize people ahead of the misinformation, only because once a piece of misinformation is out there, it's very difficult to retract. I know that social media companies are trying to sort of take them off if they're egregiously wrong and point people to credible sites. But once it's out there, it's really difficult to sort of pull it back. So one of the techniques is sort of pre-information inoculation, uncovering not just the facts about the vaccine and being transparent about the regulatory process, but help people understand the kind of techniques that people who deliberately or otherwise put out mis or disinformation uses, the kind of conspiracy approaches, the fake experts. So you got to search out for, well, who is this expert? Just because they have a doctor in front of the name, who exactly are they? Are they qualified to actually speak on the topic? Selectivity and cherry picking is another technique that people use, whereas good scientists, journalists present each side of the argument and tell you what we know and what we don't know. So cherry picking is another technique. So and realistic expectations. We've never said that the vaccine was going to be 100% effective, but people pick at that concept of, unrealistic expectations. So we have to go out there and set some expectations. So even when a vaccine is safe, effective, we're going to use it. It's not going to be 100% effective. It's just another layer of protection. I was told that I was such a downer, but I was just trying to be realistic when I was communicating the fact this is not a magic solution, and we may have to continue some of our measures, hand hygiene and everything else afterwards. The sort of fold logic and techniques. So inoculating the public with the kind of techniques that they're going to be subjected to is one tactic. And then I think of course and correct and tackle misinformation. What I said about engaging social media companies to do their part, being more engaged in those space, even though to me it's frightening because I don't know social media space, but you kind of have to get in it, and use some of the techniques that people trying to spread misinformation, and use some of that techniques ourselves, and use influencers, parents. One thing that I think we have to spend more time on is actually knowing, I think through public opinion research, that people trust their health professionals, trust their family doctors, is to give them enough information so that they can explain things, of course, to their patients.
So you spoke in your remarks about COVID is being experienced differently in different parts of the country, and even within the province of Ontario, the experience is variable. So there's a question here from Jack Wilson. It's a question about enforcement measures and the messaging, that across jurisdictions, there have been different approaches to the balancing of enforcement and communication. In some jurisdictions, breaking public health advice can lead to fines or even a prison sentence. Do you see this enforcement as helpful or as harmful to the broader project of communicating good, sound public health advice to Canadians? And how much enforcement of these rules do you think is necessary or important?
Again, there's no yes or no to this question. I do have to stress that I think social cohesion is very important to the collective response. So I think if we bear that in mind and go, what helps with that? What helps? Because individuals and collectively as communities, if we all don't recognize our role, it will be all over the place. We can't control the spread of this sort of invisible virus if we don't support that. So that's been a sort of underlying approach that I've always taken. You can also, though, look at, sometimes providing those rules in certain contexts actually really helps. If you are a store owner and it's up to the public where they, maintain physical distancing or wear a mask, it'll be all over the place. It'll be very frustrating for them, and people will, take or not take public health advice. Under those circumstances, if you ask the public, they will go, actually, it really helps to have those rules. Make it, that everybody has to do it, because otherwise it's too much for us to think about. It's too complicated. Just remove that decision from us will be very helpful. So I think that is important. Now, there are people who, of course, we enforce the Federal Quarantine Act, for example. And even we try to use a gradation of tools. You don't use the biggest tool that you have until you've educated someone and say, well, by the way, that is unacceptable. It would depend on the degree to which someone is not following the Quarantine Act and what on earth they're doing and how much harm they are endangering others. And that is assessed on the ground at the local level, and local police forces will, the jurisdiction will be able to assess on the ground what they are. So I think it's a gradation. I personally think that whatever you do has to maintain that public trust and cohesion, but sometimes it just makes things easier.
Okay, no, it's a I think really good insight. A question from Carleton from the school. What do you make of President Trump's treatment of your U.S. counterpart, Dr. Fauci? And in what way, perhaps if at all, has that affected the way that you go about doing your work and the relationships that you have either with the media or with politicians?
I don't want to comment on the US situation if I don't know enough about it, but for sure, I think we try, and as I give advice to our decision makers, and by the way, I don't make those mega decisions. It's not my decision to make. And, making sure that I provide that science-based advice, but that they recognize that being a fundamental principle is I think very important. I do wake up every morning being grateful that on the whole, the decision makers of all political parties and others have in general been thinking about Canadians and and the pandemic and managing that. Politics is always at play, but in general, compared to I think other countries, I think things have been generally well managed, and I'm very grateful that I'm not in that situation. But I have to say, the United States still has a lot of great scientists, and on a technical level, people connect and communicate, share scientific information that is really important, but it's a lot of pressure on public health professionals. I mean, I think there's been different, journalists who've looked at how much pressure public health leaders or scientific leaders are under. I certainly feel it personally, but I have to sort of refocus myself and go, okay, I'm here to every day just to get out there again, just to provide that information. But it is extremely stressful, and maybe I don't know about Dr. Fauci. He looks pretty calm, cool, and collected, but maybe he's feeling 100 times what I'm feeling. I don't know, but I think it does actually help when the public realizes that what our job is as opposed to that of decision makers, but how much pressure we're actually under. Not everybody likes what we say. We resign to that. So there's a lot of people who would tell me that I'm not doing the right thing, too fast, too slow, too soon, too much, but I think I don't make decisions singularly. I think the strength is the strength of having the tables to connect with other medical officers of health so that we can manage this challenging situation together.
That's great. We've talked a lot about the challenges of dealing with COVID fatigue, of quarantine fatigue. And you mentioned in your opening remarks, and you've mentioned this before all along, in fact, that we need to think about this as a marathon and not a sprint. Marathons are exhausting. I know as a marathon runner, both of us are marathon runners, or try to be when we're not working, and they're tiring. I think we're seeing that Canadians are beginning to fatigue around COVID. And as we move into the winter and grapple with the second wave, this is going to be a big challenge. So a question from Macklin Link is, in your view, what are steps that journalists can take to encourage people not to fall prey to COVID or quarantine fatigue?
Yeah, so I think, we are trying to set the expectation that it's going to take months, and but we know a lot more. We have a lot more knowledge than we did before. And we can use that knowledge. We know what works. And I do think having sustainable habit-inducing measures is going to help us sustain the response, so that it's not an extraordinary thing anymore. It's just part of going about safely in one's lives. That's one thing. But I think give people some milestones to look for. You know, even in the vaccine sphere, we know that the pathway we don't know for sure, but we're going to come back at certain points in time and be able to provide more information. But everybody is working really, really hard in finding those solutions. It's very important to motivate people. But I do think that there's a sense of creativity and ingenuity that we need to sort of reinvigorate, because it's about adaptation. Adaptation builds resilience, not just for this pandemic, but for other things, other hard things that a society is going to encounter. So building that mental resilience, physical resilience, community resilience is very important. I'll certainly like to take some advice from journalists as well as to how you do that. The youth, the young adults is a big piece to this. So as I said, being able to engage them in different ways. If it's gaming companies, let's have a go at that. Giving people agency, I think, is really important. You can take control of your life. You can make these steps. They're not extraordinary. You can, you know, you can do it, and you can do that in creative ways. Is one of the approaches that I wanted people to sort of be out there. I know we're probably not great at the TikToks and the other platforms, but other people are. So if we gave you a boring video about wearing masks, can you turn that into something that someone can use in a more sustained way? You know, refresh the ideas, we say the same old boring things over and over, but maybe you can do that in a more creative and more effective ways. And, you know, do your research and continue to adjust as we go along. But as I say, you know, some of the biggest milestones coming up is going to be what happens to the vaccines. And I think we can all do well in, you know, getting ourselves educated so that we can be very helpful to the public as we take them along that journey. But a vaccine does bring hope. Humans always survive pandemics, right? We've seen it repeat. So that we know is going to happen. It's how long is it going to take? And so I think giving people a sense that, you know, we're certainly looking at, you know, next year as being likely that a vaccine can be provided, but it will not be there all at once. So how do we manage that together? So I think, I'm not sure if that's the best answer, but I'm also developing ideas as I'm going along, as like flying a plane as you build it. But I think providing some behavioral science, behavioral insight-based approaches to this will be great. For some segments of the population, maybe messaging about the economic aspects of it would be more effective, for example. So I think, you know, how we ensure everybody can then go and work or go to school if we all do our part. And certainly protecting seniors and others might work for certain other populations as well. And so, anyways, I think that we can get through this, and using research-informed communication approaches.
Well, I hate to be the bearer of bad news, but we are at the end of the scheduled time for this session. I know I could stay on and we could keep going for at least another hour. There were a lot of questions that came in. We didn't have time to get to all of them, but for those who submitted, I will pass those questions along to Dr. Tam for her reflection at the conclusion of this session. So I would like to thank you very much, Dr. Tam, for taking the time out of what I know is a very busy day to share these important insights and observations. Thank you to everyone who followed and participated in the session for your attention and for your questions. And with that, we will close this special session with Canada's Chief Public Health Officer, Dr. Theresa Tam.
Thank you, everyone.